Hello and welcome to Fertile Minds. Nice to see you all again. My name is Manuela Toledo, Medical Director at TasIVF, and today we're going to talk about something that maybe a lot of people don't really feel comfortable talking about. How often should you have sex when you're trying to conceive? Because ultimately, we prefer if you conceive naturally, and some couples that come to see us, it's pretty obvious that they're probably not trying enough. Now, most women with a regular cycle will probably ovulate somewhere between day 10 to 16. And if you have that classic 28 to 30 day cycle, then we're looking at ovulation day, probably between day 13 and 16, with day 14 being sort of the most fertile day. Now, the problem is, of course, that a lot of women do not have a regular cycle, or they may have a really stressful month and they'll have a cycle that's shorter and then another month where it's a bit longer. But if you're having a cycle that's less than 35 days in length, and that means from day one of the period, it's up to or less than 35 days until the next period, then ideally we want you to start trying no later than day 10 of your cycle, with day 1 being the first day of bleeding of a normal period. Ideally, we recommend that you have sex twice during the week and once on the weekend. I know it sounds so simple. Make it your homework. Twice during the week, once on the weekend. A lot of our patients use the ovulation kits. That's okay, but don't fall into the trap of waiting for the ovulation kit to become positive. Because by the time you get that smiley face or that flashing smiley face, you may have actually missed your window. Ideally, you want to start trying to conceive that week prior to the smiley face or the positive ovulation kit. A lot of our patients have fertility apps, and we all love our apps, and I'm not telling you not to. But again, be aware that the apps can be incorrect up to 50% of the time. So we don't want you to rely on the apps. We don't want you to rely on the ovulation kits. And we definitely don't want you to save yourself until those apps and kits become positive. The earlier you start trying, the better your chance of conceiving. And it's also much better for the sperm to start trying early. So if a man is ejaculating every 2 to 3 days, then that means there's a fresh wave of sperm coming through every 2 to 3 days. And the sperm will actually hang around in the female's uterus and tubes for up to 4 days. In fact, there's been cases of it hanging around for up to 7 days. And so that's why, if you look at the other side of things, some people conceive accidentally when they're not planning to. But most good, normal quality sperm will hang around for 3 to 4 days quite easily. Now, if that hasn't worked for you and you've been trying to conceive for 6 months or longer, obviously please come along and speak with one of us fertility specialists. And definitely if it's been 12 months and nothing has happened, it's really important to touch base with us. Please be aware that if you have a very long cycle, it means you're probably not ovulating for quite a long time. And in that situation, we may want to help you with cycle regulation. That can involve a hormone tablet, it can involve hormone injections, and we'll tailor it to you based on your particular medical history and requirements. So that's all for today. I hope that was helpful, and we look forward to seeing you again next time at Fertile Minds. If you enjoyed this little chat we had today, please subscribe to Fertile Minds. Take care.